Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Okay, so we know that it's the leading preventable cause of death in the United States. 400,000 each year, or 1 out of 5 deaths. And globally, it's increasing also. We have 5.4 million deaths per year, 80% from developing countries mostly. So most importantly, the diseases that are related to smoking is atherosclerotic cardiovascular disease, mostly coronary artery disease, lung cancer, and chronic obstructive pulmonary disease. So anyway, so the top 10 causes of death in the US, you'll see 1, 2, 3, and 4 are all related to smoking. We have the top 4 all related to smoking: the diseases of the heart, malignant neoplasms, stroke, which is part of atherosclerotic heart disease, atherosclerosis, and the chronic lower obstructive lung disease. So accidents may be from smoking, but that's not the cause. So that's why it's very important. So it's associated with clear health benefits, and it's a major health goal for all of us. So the prevalence, let me just give you an overview. So during this smoking started post-Great Depression, post-World War II. During the Korean War, there was early reports of linking smoking and cancer, and the first Surgeon General report in 1965 said that it's linked to cancer. So that's why, as you can see, there's a decrease in the use of tobacco smoke. 1965, 42% of adults, Americans smoke. Now only 20.6% decline, but it's slowing down. And the goal is actually 12% by 2010. So at the end of 2010, we'll find out whether we're at goal or not yet at goal. So the tobacco, 80% of people smoke daily, those that are already addicted to it, 20% less frequently. And if you look at women and men, there's a slow decline. And you'll see that the decline in women is less than men. And currently, about 50% from 1960s to currently has decreased from 50% to 23.1. But in female, look, only 18.3%, that's less decline in women. And it's probably because they want to look good, and because it increases weight gain. And we're more stressed now, maybe. I'm not sure. But those are one of the different causes. Look good. Those were all the commercials before. So almost every adult started smoking by the age of 18. Half high school students tried smoking a cigarette. So it actually starts early. When we do our smoking cessation lecture, we start at grade 6 to 12. If you give lectures at 18-year-old, it's too late. So we as pulmonologists and with chest physician, we do our campaign early on, grade 6 level. 20% tried in the past 30 days, and 8% smoke frequently. So these are the commercials in the past. It's less now, but it was glorified then. So why do adolescents smoke? Usually their parents or friends are smoking. They're living with a smoker. They have strained relationships with either parents or friends. Single parents tend to have more adolescents that smoke. Low self-esteem and self-worth is another cause. Comorbid psychiatric disorders, availability of cigarettes. Boys, high level of aggression and rebelliousness, and women, girls, preoccupation with weight and body image. And there are also just some gene studies that shows that maybe we're prone to be dependent. We just don't know how it is, or who are those that are more prone. So that's why it's better to avoid it than starting it, because once you start it, then you might not. It's probably harder for us to get off it. So it's the chief avoidable cause of death in our society. I've proven that to you and showed you the statistics. It is not just a habit, it's a chronic medical disease. So we have to recognize that. It's not a habit, it's legalized, but it's not a habit. It's a chronic medical disease. And that's why Dr. Wright said tobacco dependence is a chronic, relapsing, life-threatening illness that requires long-term medical treatment. So you have to tell your doctors, and we already know, it's just like hypertension, diabetes, hyperlipidemia. It has to have that importance in terms of treating tobacco addiction or cigarette smoking. It's a chronic long-term process. If we treat it like that, then the success rate hopefully will be better. So that means it's not just a 6 to 12 weeks kind of a program. It is a long-term kind of a program for all of us. So November 18 this year is annual Great American Smoke Out, and we're encouraging everybody to at least stop smoking that day, or try to think about quitting for good, or try to think about maybe asking some help. And just like any addiction, like my addiction to food, we all struggle with this. There's nothing wrong with trying to think about it. Actually, I congratulate my patients who thought about it and tried it. So what if you fail? The measure of success is not when you quit. It's the measure of how you stand up after a failure. I always tell that to my kids. Oh, yeah, they said. But that's how it is. So hopefully by November 18, or maybe most of you have thought about looking into it, we at least stop smoking that day or think about quitting. So as I said, many current smokers are trying to quit. 40% of daily smoker report greater than 24 hours abstinence, which is good. And then it's not just cigarette. There are other things that have problems too. Cigars and pipes, although we don't inhale too much, it has the same risk as cigarette. Smokeless tobacco, chewing tobacco, or snuff can have their own, you don't inhale them, but you chew on them, so you can have oral cancer. So just want to let you know that these are other tobacco products. Water pipes, recent especially with young adults. Those, I forgot the name of them. But they now have the hookah or whatever. They have places where they can do it. So when you quit smoking, and I don't have the pointer right now, but the lung function improve. Goes down rapidly if you don't stop smoking. If you never smoke, you see, your lung function, we get older, so our lungs get older. About 30 ml, 30 cc's per year is how we get, decrease in lung function. So as we get older, our lung function diminish, but look at how it is there. If you don't stop smoking, it will, at age 75, you're almost like less than 20%. Less than 20% of lung function, you're alive, but you can barely move. You get short of breath on minimal exertion or just talking. So if you stop at 45, you see you are have really improved your lung function. And these are all the health effects of smoking. We discuss about the three main: lung disease, heart disease, and cancer. But because of atherosclerosis, you can have decreased blood flow, the penile area, and you can have impotence, stroke, cataracts, gum disease, osteoporosis, miscarriage, tooth decay, depression, skin wrinkling for females. And I said about the pregnancy complication, peptic ulcer disease can also be worsened by smoking, and osteoporosis. So lung cancer does not discriminate. We know somebody is struggling right now, our president, right? Struggling to quit smoking. And you can be at risk. Peter Jennings in 2005, very good, commentator, but he succumbed to lung cancer. But of course, cigarette smoking 80% of the time will cause lung cancer, but not all lung cancer is due to smoking. Just to let you know about it. So the trends in incidence of smoking-related cancer: bladder cancer is up there. Smoking causes bladder cancer. Oral cancer, pancreatic cancer, laryngeal cancer, and esophagus. These are all the smoking-related cancers, and it still is. This is 1999 data, but I just want to let you know it still is there. So aside from lung cancer, it also causes these other kinds of cancer. Now, if you have lung cancer, what's your chances of survival? Look, it's down there. It's the gray line there. Your chances of 5-year survival is minimal. Even now with new technology and new treatment for lung cancer, it's still on the low side. And all the rest, melanoma, breast, prostate, they have better chances than lung cancer. So we better, even if you're smoking now and you quit, you can still have benefit like this one. If you quit less than 1 year, that's your benefit. If you quit more than 15 or 16 plus years, you're almost close to the non-smoker rate. So it's better to do it now so that hopefully in 16 years, you're almost close to the smoking, so non-smokers. That's why it's still beneficial to quit smoking even at this point in time in your life. So just to go back to the kids, more than 3,000 kids start smoking every day. That's more than 1 million every year. That's 1997. It's still true, 2010. Teens account for 85 to 90% of new smokers. That's why we start grade 6. We start at age 12. And then now actually it's 80% of American students grades 9 to 12 have tried cigarettes. And that's still true. It's 80% now. Of the young adults who started smoking in their teens, 25% will die prematurely in the middle age and 25% will die in their old age. So teens who smoke are more likely to use alcohol, 3 times more, 8 times more likely to use marijuana, 20 more times likely to use cocaine than teens that don't have. This is by CDC in 1996 and still same in 2010. It's just tough giving them up according to the big tobacco company kids. So I'm sorry, I'm smiling, but it's not, it's serious. So the key messages is smoking rates among children grades 9 to 10 are higher than among adults. Smoking habits develop in adolescence and tend to be carried into adulthood. And nicotine is legalized drug, more addictive than marijuana, cocaine, and heroin. We'll go more to it later on. So these are just some of the substances that are in cigarettes. There are 4,000 carcinogens. These are the most important. Nicotine is the addictive one. The reason why we can't get off cigarette smoking is because of the nicotine, because it's a psychoactive kind of drug. It releases dopamine, we'll say. But look at tar. Tar is a very carcinogenic substance. Carbon monoxide binds to your hemoglobin, your red blood cells, and decreases oxygen delivery to your tissues. That's carbon monoxide, you know, from burn. Cadmium from batteries, you know that. Ammonia, hydrogen sulfide. Cyanide, like in rat poison, is there when you inhale. Arsenic. I think most of you know formaldehyde, the one you use to embalm dead bodies. So those are in your cigarette. And on a vapor phase, you have those, and particulate. These are just scientific names. You have it on your handout. And again, death from preventable causes is diet. Tobacco is number 1, and diet and exercise is number 2. Alcohol is there. These are all preventable things. Again, risk factors for cancer deaths. Tobacco is again same as diet and obesity. Now it's tobacco as the risk factor. And this is just an illustration of cigarette, and this is from, in the 1990s, showing that cigarette smoking can worsen atherosclerosis from the thyroid to your brain to your pancreas to high blood pressure, everything. So when you have atherosclerosis, it causes decrease in blood flow, it causes chronic ischemia, and it can cause small infarcts causing dementia, or it can also cause big infarcts causing the stroke. It can also infarct the kidneys, and it can cause stenosis of the artery and can cause aortic aneurysm or infarct mesenteric ischemia in the stomach, or blood flow to the heart causing heart attack, or blood flow to your leg causing gangrene. So pain in the legs can cause peripheral vascular disease causing gangrene. Now, when you chew tobacco or inhale it, you can also have premalignant lesion in the mouth, or tumors, oral ulcers, or in the stomach, in the sinuses. As you inhale all those tar, that can also be caused. Thank God, probably you have good genes. But some of us, we don't have good genes. If we have a family history of cancer, family history of things, the more likely you should not continue smoking or stop smoking. Those are leukoplakia. If you see those thickened mucosa. And then again, let's go back to women. So it's associated with reduced fertility, early menopause, increased likelihood of you not to become pregnant. And when you're pregnant, you also have decreased 25% of normal amounts of oxygen from reaching the placenta. And also it increases the risk for sudden infant death syndrome. So the nicotine, carbon monoxide, and thiocyanate, you produce 20 to 30% of low birth weight, and 14% of preterm deliveries, and 10% infant death. So a mother smoking of 10 or more cigarettes a day appears to raise the risk of sudden infant death by 70%. That's why it's a no-no. If the mother is also anemic, the rise is 300%. Okay, the other reason why you want to stop smoking is because of the secondhand smoke. It's not really risk-free. So you're not only injuring yourself, but your neighbors, your family. And that's why now in California, we don't allow smoking in certain restaurants or in the hospitals and things like that, because it's not risk-free. Each year, secondhand smoke is responsible for 37 deaths from heart disease in adults, 3,000 deaths from lung cancer, 13 deaths from other cancers in adults, and 300,000 cases of lung infection, pneumonia, bronchitis in infants and young children. An infant exposed to secondhand smoke, you increase the risk for asthma, pneumonia, bronchitis, and otitis media. So secondhand smoking is not cool. Now let's go to non-cigarette. It's cigars. The number is increasing, and it's in vogue, lately in the last couple of years, but it's not a safe alternative to cigarette smoke. And again, the secondhand cigar smoke. So cigars is a major source of secondhand smoke, and it's high likely that most toxins and the 60 known carcinogen compounds found in cigarette smoke are also found in the cigar smoke. You just inhale less, I guess, but it's still there. And young people, there's increase in use among young people. 27% of young people aged 14 to 19 smoke a cigar in the past year. Teen smokers are 3 times more likely to use cigars. Stogies, it's not really safer. It causes lung cancer. And then the other, also non-cigar, is the smokeless tobacco. It has nicotine, that's why you're addicted to it. You want to use it, and you chew it, but it can cause cancer of the mouth, cheeks, gums, and throat. So it can make you sick, disfigured, or dead. So smokeless tobacco is not really an alternative. I guess they're having some studies in Sweden, it's called snus, where they're making it safer. It's being used in Sweden, and they're studying it. So right now, it's not. In the US, it is not safe. So specialty cigarettes, the clove cigarettes, Kretex, tobacco, and 40% ground up cloves imported from Indonesia, and Baidies or Bidis, finely ground sun-dried tobacco rolled in a brown tendu, imported from India. These are very popular among teens, used mainly by teens or 20s, new wave image. It's aromatic, it numbs the mouth. There's a eugenol, which is an active ingredient used by dentists, removes the unpleasant effects of the first-time cigarette smoker, and you cannot smell the tobacco smoke. But sometimes, when you get too much of it, you numb the throat, and then they choke and die. You aspirate sometimes. So that's the danger of it. And then the bidis, the same thing. So the key message is tobacco companies use niche marketing to target those groups of women most likely to smoke. Currently, 80% marketing, 20% advertising. 12 to 17 years old have responded to the tobacco promotional programs. So they say cigarettes are not addictive, cigars are not addictive, smokeless tobacco is not addictive, only profits are addictive. So see, I'm anti-tobacco establishment manufacturer. So just briefly, I'll talk about lung cancer. I hope you're not so depressed enough, but this is the reality. I want you to be well informed about what cigarette smoking is. I want you to be well informed about the effects, and you can ask me more questions later on. So it's the leading cause of death in the US now. And this is from 2005 data. It's still more than colorectal and breast, and more among female, black more than white. And then the chances of survival, already told you, it's about 15% survival. When you have pancreatic CA, it's really bad, 4%. At least lung is about 15% survival rate. And all the rest have better chances of survival. Prostate is the best, 99% survival. Again, just to reiterate, it's the most preventable cancer death in our society. So I already told you about the different cancer associated with smoking. I'm not going to go through it. This is, the left one is a normal airway. This is a bronchoscope. When I do bronchoscopy, I look at the airway, and that's anthracotic. You see the black tinge there? Those are tar from inhaling. So it's obvious. Now, if you have those disfigurement, growth there, those are, on biopsy, that's lung cancer. So they mostly start bronchogenic in the airway, and then they spread out. So this is just calculating your risk based on when you stop smoking. I belabored it before. That's a tumor on the left side after the aorta. So the most common cough. And sometimes when my patients quit, I said, "Doc, I quit smoking, but I'm coughing more. Why is that so?" When I smoke again, the cough decreases. And the explanation to that is the smoking irritates the airway and the irritation, inflammation cause you to cough. When you stop smoking, the airway starts to regenerate. And then it regrows the cilia, the small hairs, and that tickles the airway and causes it. So that's good, because it means that you still are are regenerating those cilia, causing you to cough. So I tell my patients, that's normal. When you stop smoking, you'll have more coughing. I kind of warn them. But don't smoke. Just go ahead and get some Robitussin or whatever to stop the smoking relief. Unless, if it's worse or you're wheezing, then just call us back. But you can get cough after you stop smoking. So again, this is a chest x-ray of an emphysematous lung. You can see the black thing that means all air and bullae. And this is the autopsy, where you can see the lung bullae filled with pockets of emphysema. And sometimes you can be a pink puffer. This is how you look, where you're emaciated, or you can be a blue boulder. You're big but cyanotic or bluish. And this is how emphysema looks. Instead of a normal lung, you'll see big spaces on autopsy. So why? Why is it so hard to quit smoking? When you inhale nicotine by cigarette smoke, in 10 to 19 seconds, it reaches the brain. And scientists have to come up with a product, a nicotine replacement therapy, that can compete with this. Because the other drugs, the gum, the nasal spray, the inhaler, it takes about minutes. This one is 10 to 19 seconds. That's why we have not come up with a product. But for you guys, just to let you know, that's why it's so hard to quit. So it's absorbed to the skin and the mucous lining, and inhalation. It activates the circuitry of the brain, and you have the feelings of pleasure because of the dopamine, and we'll go to it later on. The dopamine is the key chemical product, and it produces distribution to the brain. So dopamine is the product that is released and causes pleasure and cognitive arousal. That's why sometimes, Doc, I need to smoke so that I can concentrate, because you release all these substances. That's why. And we boil it to a science. We have norepinephrine, cognitive and appetite suppression, acetylcholine, memory and cognition. These are all the good effects of nicotine. Unfortunately, it comes with the 4,000 carcinogen, right? Vasopressin, memory, water balance, anxiety reduction, and mostly the weight reduction is from norepinephrine. So there's a kick, immediate kick. It's the adrenaline discharge in, I said 9 to 10 seconds. So that's the reason why it's so hard to get rid, because of the nicotine addiction. But there is treatment for it. And as long as you know that it's a chronic medical illness, there is treatment for it. The success rate is not 100%. And before we go to the treatment, this is the genetic factors I was talking about, that for cigarette, you don't know whether you have the genetic factor to be dependent or not. You'll know when you start smoking and you can't get rid of it that maybe you're 90% dependent. When you drink alcohol, you only become 10% dependent, so you can quit it sooner. And even better, heroin users, about only 50% physiological dependence. So it's really harder to quit smoking than heroin and alcohol. And that's the reason why. So the benefits of cessation is to live longer, to be able to help your family and friends not smoke, and to even if you develop lung disease or cancer, if you quit smoking, it's not too late, because you have the lung cancer. If you continue smoking, you can develop a secondary cancer also. So it's still better to quit. So the management of nicotine addiction is usually you talk to your doctor, because he or she is the one that's going to help you go through this. Or if she's not good at it, ask for somebody that's a smoking cessation expert, mostly pulmonologists. So because they will treat you like you have hypertension or hyperlipidemia, where it's a chronic illness. Cold turkey, in some cases it's successful, but it's usually a combination of behavioral modification plus medication. And these are the medication. The first line actually is the nicotine replacement, and then we have the Chantix, which is varenicline, bupropion, which is an antidepressant, and this is experimental. And we'll go through it one by one. So Chantix, varenicline. So varenicline is it goes into the receptor and blocks nicotine absorption. So it reduces the nicotine withdrawal and symptoms of cigarette. The side effects, though, is you can have nausea and abnormal dreams. And in small proportion of patients, you develop suicidal thoughts, aggressive and erratic behavior. So you have to let your doctor know that, doc, I'm having these thoughts. You have to have a good relationship and conversation with your doctor and let them know. There's no stupid question, there's no stupid comments, you just need to let them know how you're feeling. But it's been successful with behavioral therapy and also with nicotine replacement. Bupropion is an antidepressant that helps. Also, the side effect is dry mouth and difficult in sleeping, and it's not recommended if you have a seizure disorder, if you have had trauma before, depending on how long it is, anorexia nervosa or bulimia, and excessive alcohol use. And then I'm sorry, this is a not so good slide, but there are short-acting nicotine replacement therapy and the long-acting. The short-acting, meaning to say the onset of action, the short-acting is nicotine gum, nicotine inhaler, nicotine nasal spray, and the lozenges. Most of this nicotine gum, inhaler, and lozenges, usually the onset of action is between 20 to 30 minutes. So, you still need to wait as compared to when you inhale the cigarette, right? Seconds only. The nicotine nasal spray is actually better, they said, within 10 minutes. But the problem with that is it's irritating to the nasal passages, but you can try it. And by the way, and these are all the short-acting onset nicotine replacement therapy. The nicotine patch is long-acting. It's going to be, it takes about a couple of hours, but it stays with you all throughout to decrease the withdrawal symptoms. So my technique is combine the nicotine patch with the nicotine gum, and I park it. You can't chew it and then swallow. You have to park it to have absorption. Chew and then park, and then chew again and park. The same thing when you have your lozenges. You have to park it somewhere so that it can get absorbed in the system. And don't swallow it because it will just have gastrointestinal effect and it's not going to work. It has to be absorbed in the mucosa. That's why the nasal spray is good, because it goes into the nasal mucosa and it's absorbed. In 10 minutes you have the kick, the withdrawal kick. So I combine the patch plus either a gum or a nasal spray. I have all my paraphernalia. I tell my patients, have gum here. Depending on the situation, you can use it, or you can park your gum while you have your patch. And if you can do it as a single therapy like nicotine replacement, or you can add bupropion, or you can add Chantix. In Wellbutrin or bupropion, you have to take it like a week before you start the quit date. And in Chantix, there's all these other possible. I think you start with 1 dose first, and then you increase the dose. So the other second line is clonidine, which is used for blood pressure, and nortriptyline, which is also an anti-depressant medication. So short-acting, and it's okay to take 2 or 3 different kinds of nicotine, whether it's a gum or spray or inhaler, plus your patch. And if that's not enough, if you're really very dependent, greater than 25 cigarettes smoking per day, you might need pills also, the Chantix or the bupropion. And you have to be honest with your doctor. Doc, what's your plan of action? What are we going to do? What are your expectations? What am I going to do? And you have to follow up with them. I follow up my patients between 4 to 6 weeks, because they're, and then they call me once in a while. I don't practice pulmonary medicine anymore. I'm a critical care doctor now, but cigarette smoking is my passion, and I see them at the end stage already, where they're critically ill. And that's why I wanted to do this lecture, because I want for this patient not to go to the intensive care unit, to avoid seeing me at the intensive care unit. So rimonabant Acomplia is one of those promising drugs that is not FDA approved. It's a selective cannabinoid receptor antagonist and helps smokers quit, and also post-cessation weight gain. But there were some safety concerns. Again, more of the suicidal thing, that it's not, it's not being used in US, just FYI. And then there's one thing that's being done, promising the nicotine vaccine. We can probably vaccinate everybody when they're like grade 6, because the vaccine causes an antibody, it generates an antibody against nicotine. So when you smoke, the nicotine binds to the antibody gets hold of the nicotine, and then it decreases because of the big complex, it doesn't get into the brain. So you don't feel the good effect of nicotine. And then eventually you'll probably, hopefully, not smoke. So these are good for, well, it's still under trial, but I'm just saying that maybe in the future there will be some use to it. Have you heard about the e-cigarettes? Okay, the e-cigarette is cool, but it's nicotine, so you can get addicted to it. It has no tar, no carbon monoxide or cancer-causing chemicals, no irritating secondhand smoke or nasty smell, so that takes care of the secondhand smoke, no meshy ash or cigarette butts. You can choose the nicotine strength too, with different vapors, and it's cheaper. That's what they're saying, but it's still new. So it lights when you inhale. It lights up, so you have that behavioral modification kind of a thing. And as you see, there's battery, there's atomizer, and then the filter as you inhale it. It's something new, it's something to look into, and something that you can discuss with your doctors in the future. So why is it so hard to quit? Because it feels good when you smoke, and then it's bad when you have the withdrawal symptoms: anxiety, irritability, frustration. It's a cause for divorce sometimes, or cause for some aggression, restlessness, craving for cigarette, depression. So if you know this, and this is going to happen, just warn them. And then if you know the symptoms, hopefully you have a gum there, or you have a nasal spray there to help you out. And after a few seconds, the craving decreases also. But it's nice for you to know this, so that if you're not the smoker and you're just a family that supports a smoker, you'll understand better. And the Fagerstom, there's a criteria to know whether you're high nicotine dependent or not. More than 25 cigarettes a day is, I guess, high. And also you need to check with your doctor how much nicotine gum. There's a 2 milligram and 4 milligrams. If your Fagerstom is high, greater than 7 points, you might need the 4 milligrams gum, the higher doses, more than the low doses. If you're less than 25 cigarettes, you might only need the 2 milligrams. And you can chew it, a couple of times a day. If you smoke within the first hour after you wake up, that's not really good. And cigarette smoking associated with meals, the first cigarette in the morning, kind of thing. Those are all signs of dependency. So indication for need for long-term medical management: high nicotine dependency, 1 or more prior quick attempts, heavy smoker greater than 20, now it's 25. Patient is a woman. If you're a woman smoker, that's indication that it's probably going to be a long-term kind of use. And then nicotine withdrawal symptoms present on prior quick attempts, began smoking at younger age, and other active smokers in the household, history of depression, drug abuse, and alcohol use. So I'll just read this to you because it's a busy slide. Within 20 minutes of stopping smoking, blood pressure drops to normal, pulse rate drops to normal, the body temperature of hands and feet increases to normal. After 8 hours of stopping smoking, carbon monoxide level in the blood is back to normal. Oxygen level in the blood increased to normal. After 24 hours of smoking cessation, the nerve ending starts to regrow. Ability to smell and taste improve. After 72 hours, bronchial tubes relax, making breathing easier, lung capacity increases. About 2 weeks to 3 months after stopping smoking, the circulation improves, walking becomes better because lung function improves up to 30%. In 1 to 9 months' time, coughing, sinus congestion, fatigue, shortness of breath decreases, the cilia regrows in the lungs, their increased ability to handle mucus, clean the lungs, and reduce infection, and body's overall energy level increases. After 5 years, lung cancer death rate for average smoke decreases by 137 to 72 per 100,000 people. And after 10 years, the precancerous cells are replaced with normal cells. The risk of other cancers, such as those of mouth, voice box, and esophagus, bladder, kidney, decreases. So those are all the benefits of smoking cessation. So it's never too late to stop smoking. Quitting is hard, but not impossible. Thank you very much.